All right, so welcome to part 2 of our therapy. It's not really therapy, it's 2019 booklet, but we are doing the therapy one, the therapy base, but it's 2019 booklet. Okay, so let us begin right away. We're having a 28-year-old man complain of skin rash and itching on both of his hands. The condition persists for 1.5 years. The exacerbation of his condition he ascribes to the occupational contact, guys, occupational contact with formaldehyde resins. Objectively, the lesion foci are symmetrically localized on both hands against the background of erythema with blurred margins. There are papular vesicles, erosions, crusts, and scales. What is the most likely pathology? Definitely, they've already told us what this person is. And we have already explained the concept of what eczema or dermatitis is, because this person is having what? Dermatitis. And we said dermatitis can be the same as what? Eczema, whereby there is definitely a disease of the skin, which normally leads to what? Rashes, itchiness, and redness of the skin. And that's what has been what ascribed over here. And again, we said, depending on the pathogenesis of the occurrence, then we can know the different types. So it can be allergic, it can be occupational, it can be simple contact dermatitis, and so on and so forth. But over here, from the history, we could know that this person is having what we call occupational eczema. Occupational, because he ascribed the condition or the exacerbation of the condition to occupational contact with formaldehyde resins. So it is easy for us to quickly diagnose this person as what? Or the pathology as occupational eczema. Occupational eczema. So the answer is C, occupational eczema. All right. A 20-year-old student, after failing an exam, developed complaints of a sensation of a round foreign body in her throat. Round foreign body in her throat. Difficulty swallowing. She fixates on her condition. Limits her diet. Often cries. Seeks attention. Exhibits demonstrative attitude. She is highly susceptible to psychotherapeutic suggestion. What psychiatric diagnosis can be made in this case? Look, this person's condition is developing as a result of what? Failing. And that is why, for me, one of my tasks, if I should put it, on this earth, is to prevent people from failing exams as much as I can. And that's why we are doing some of these things here, to prevent what? Failure in exams. Because failing in exams can lead to a condition such as what we are witnessing right now. Psychological what? Problems. Okay, because imagine all your mates passing exams and only you go and fail. It will demoralize you. It will make you feel bad. And if you don't take care and condition yourself very well, you can't come back again. And that is why, for me, I try as much as possible to make sure this thing doesn't happen to anyone. But of course, we can't prevent it. They always happen. But we want to reduce the impact. We want to reduce the number of people who might be suffering from these kind of conditions. So basically, these kind of things, we refer to it as hysteria. Refer to it as a hysteria. And a hysteria is just a neurotic defense in which symptoms of some physical illness appear without any underlying organic pathology. So if you realize there's no really underlying cause for this neurological symptoms, no underlying cause, and that's over here. We are describing this as a hysterical neurosis. Hysterical neurosis. And again, like I said, usually due to a response that you elicit because of failing. So we call it what? Hysterical neurosis or hysteria. So your answer here should be A, hysteria. So those who fail exams, who are concerned about exams, failure in terms like this, they normally have, if they don't take care, they'll end up developing Hysterical neurosis. So please, let's be guarded. So your answer here is A. A woman with atopic bronchial asthma was found to have one allergen to her dog hair. Carpets were removed from the apartment. The apartment was renovated. The air conditioner was installed. However, recurrent asphyxia attacks still occur every single night, despite the patient undergoing pathogenetic therapy. What long-term treatment tactics can help this patient to decrease her sensitivity to the allergen? So definitely you want to conscientize this person about the allergen that perhaps she's been facing with, isn't it? And one of the ways to do that is to do what, or the term, we call it hyposensitization. So you want to reduce the sensitivity to that allergen. So it's a way of conscientizing the person that this one you already know it. So don't get frightened when you say it or when you begin to take them in. So you want to do what? Hyposensitization. And this should be what? A specific one, because it's a one type of what allergen. They tell one type of what allergen. One type of allergen. Okay. So you want to have what you call what? A specific hyposensitization reaction or allergen immunotherapy. Allergen immunotherapy or desensitization. Desensitization. They all mean the same thing. So either you use the word desensitization, hyposensitization, allergen immunotherapy. They all mean the same thing. They all mean the same thing. So over here, you are gradually exposing the person to that particular what allergen. So the person will start developing immunity against that allergen. So that when the next time when they come in, the person will not react to it. So again, your answer is a specific hyposensitization. That's why your answer is B. All right. So we have a 20-year-old man who was hospitalized on the 9th day of the disease. He attributes his disease to eating of insufficiently thermally processed pork. That means undercooked pork. Undercooked pork. So you ask yourself, what infection can be found in pork? That is, I think pork comes from pig, isn't it? So that can be found in pork. So they say at its onset, the condition manifested as a periorbital edemas and fever. Objectively, the body temperature is 38.5. The face is puffy and the eyelids are markedly swollen. Palpation of the gastrocnemius muscles is sharply painful. Blood test shows, guys, look, shows hypereosinophilia. What is the pathology? What is the etiology? What is the etiology? So over here again, the clue here to help you with the diagnosis is undercooked pork. And so therefore, you are thinking of Trichinella. You are thinking of Trichinella. And again, they have very, very, very specific, how do I put it? In the blood, you normally see a lot of what? Eosinophils. A lot of eosinophils. You can see a lot of eosinophils. So over here, we are looking at what? Roundworm Trichinella. So your answer should be what? Should be E. I saw I think Sharif having some nice concept about some of these gastronym. Sometimes you might get confused that this might be what? Leptospirosis, because you have seen what? A gastrocnemius what? Muscles. But please look at the pathogenesis before you start thinking of what? Leptospira. Okay, or leptospirosis. This is not leptospirosis, but rather what? Trichinella. So your answer is E. In lepto, they might bring some S, something that some C and S things be there for you, and other things that can help you with the diagnosis. All right, so we have a 40-year-old man. A 40-year-old man claims that his wife is cheating. He's claiming that his wife is cheating on him and present a proof of her infidelity. He repeatedly initiated scandals with his wife at home and at work, demanding that she confess her infidelity, insulted her, and threatened to kill her. What preventive measures should be taken against socially dangerous action on his part? Guys, so those of you who are very, very, very obsessive and think about your partners and stuff like that, some of these things you go to extreme. Okay, you go through extreme. The fact that I'm talking to Bridget, I'm talking to Dami, I'm talking to Eugenia, doesn't necessarily mean that they are my wives or they're my girlfriends. Okay, so Alphonse, being so jealous, will want to cause trouble, isn't it? So assuming Alphonse's wife is perhaps Eugenia, for instance, okay, and Eugenia is my very good friend, and because we are very close, Alphonse might be saying that, oh, Eugenia is cheating. You and me, I'm in Ghana. Eugenia is in Ukraine. She doesn't even chat me, Seth. She doesn't even chat me. But that notwithstanding, don't be too obsessive with some of these, because we become too obsessive to the point of even trying to kill her or threatening to kill her. Guy, you need a psychologist. You need a psychologist. You need a psychologist. You need a psychologist. Or let me just say, basically, so you can confuse psychologist with a psychiatric person, because literally you are going crazy. Okay, you are going crazy. So although you might need a psychologist too, but basically we'll go in for the psychiatric proper, because Charlie, this is called emotional psychosis. That's the term we use it for. Emotional psychosis. Emotional psychosis. Emotional psychosis. So you need to be seen by a consultant. So therefore, over here, we'll go in with what? A psychiatrist rather than a psychologist. Of course, after going to the psychiatric person, you know, they're all your emotional thing. So a psychology can also what? Come in. But with the two, the psychiatric will be more proper rather than the psychologist. All right. So over here, we're going in with a psychiatrist, because you are literally going mad. All right. A 55-year-old woman complains of pain and popping sounds in her left knee joint, which occur when she climbs the stairs. Occasionally, during movement, her joint becomes stuck. 5 years ago, she suffered a trauma on her left knee. Complete blood count and biochemical analysis shows the normal result. X-ray, guys, look at the X-ray. X-ray shows what? Osteosclerosis and osteophyte. Now, osteophyte simply refers to a growth or an extension from your bone. So your normal bone is there, but there's an extension, there's an outgrowth. Let me put it that way. There's an outgrowth. And usually this is very, very, very what? Clinical or very, very classic in osteoarthritis. Very, very, very classic in osteoarthritis. It is not common in rheumatic arthritis, but rather it is common in osteoarthritis. Because there are two very good differentials: osteoarthritis and rheumatoid arthritis. But for us to have this osteophyte projection coming out, we are more looking at what? Osteoarthritis rather than rheumatoid. In rheumatoid, you don't see this kind of thing over there. All right. So over here, we're looking at what? A. We're looking at A. All right. A 40-year-old man, a welder, okay, uses manganese electrode in his line of work for 18 good years. He complains of difficulties with writing, bad mood, inertness, gait abnormalities, problems with speech, and hand tremors. So definitely we're having what? Neurological what? Symptoms. Objectively, the following are seen. Hypomemia, increased muscle tone of plastic type, quiet, monotonous speech, tremor of the tongue, pill rolling tremor of the fingers, and retropulsion. What syndrome has developed in this person due to the manganese poisoning. Manganese poisoning. Now, we know that manganese is very essential in the growth and in neuronal functions or neurons functions. Okay. So when there's an increase in how do you call it, manganese, usually it leads to Parkinsonia-like syndrome. It normally leads to Parkinsonia-like syndrome, known as, or normally referred to as manganism. 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 So the term manganism, which means manganese poisoning, also means we are having what? Parkinsonia-like syndrome. And that's why over here, we'll go in for what? Parkinson disease or Parkinsonism. Parkinsonism. Because it also means what? Manganism. 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 Manganese. So manganism. Good. So over here, we're looking at what? Parkinsonism. 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 All right. So here we're looking at what? At D. So over here, the midbrain is affected. The midbrain is affected because that's where I think the red nuclei, if I'm correct, is found. All right. So here is D. Is D. All right. A 45-year-old man developed a constricting retrosternal pain. Constricting retrosternal. So that means angina has come in already. That occurs during walks at a distance of 200 meters. At a distance of 200 meters. I think we have talked about the classification of angina. Okay. Looking at class 1, class 2, class 3, class 4. We've talked about them. Heart rate is 80 per minute. BP is 160/90. During cardiopulmonary exercise test, a 50, what is 50W? There is a depression of ST segment, of course. So that means myocardial infarction. By 3 days, what provisional diagnosis? What is your provisional diagnosis? Dr. Bridget sent me some question on ECG. I was so busy I couldn't attend to it. Please do it to remind me. I will try and look at it again. That's Bridget from Venetia. Okay, so we have what? What is your provisional diagnosis? So again, this is how do you call it? You need to know the classification for angina, isn't it? You know the classification for angina. So in that way, you answer this question. We have done it already, but for the sake of revision, I will go over it again. Now, according to the New York Heart Association, there is what? A classification for angina according to the New York Heart Association. We have class 1, or in class 1, there is no symptoms and there's no limitation in ordinary physical activity. So if you do normal activity, you will see no pain, you will see no symptoms. Okay. Now, in class 2, you will see mild symptoms and slight limitation during ordinary activity. During ordinary activity. So the thing that first you will do, it will not cause any problem. Now, when you do even a slight activity, it starts causing what? Some mild symptoms. And that is what? Type 2. That is type 2. Type 2. All right. Then we have what? Class 3. So in class 3, we are having a marked limitation in activity due to what? Symptoms. Even during less than ordinary activity. Less than ordinary. So even on a normal day, you can walk, and then you have some small pains. That is type 2. But if even with a little walk, you are having a severe pain, then this is type 3. Type 3. Type 3. And usually, when a person walks about 100 to 20 meters, the person starts having shortness of breath, start having chest pain, and all those kind of thing. Okay. Usually around 100 to 200 meters. So over here, we might be looking at what? Type 3. We might be looking at type 3. But again, in type 3, when the person rests, the pain disappears or the symptom disappears. Symptom disappears. Now, in type 4, even during rest, there's a problem. Even during rest. Even during rest. There is severe what? Even during rest. Okay, so basically, we are talking about type 3 over here. And I believe I've made everything clear. So please, if you are still lost, do well to watch our previous videos because we've done them in therapy. All right. So over here, we're looking at C. We're looking at C. All right. Okay. This is one of the another question that might help us. A 45-year-old man, a farmer, presents with acute onset of a disease. He complains of headache, high temperature, pain in the gastrocnemius. Guys, pain in the gastrocnemius. Just like what I talked about the last time. Now look at this feature, and then let's look at what the answer will be. We're having what pain in the gastrocnemius. That's the calf muscles, anyways. Then we're having what ecteric face. That means yellowish face and dark urine. That means jaundice is even what present. Jaundice is present. Objectively, the body temperature is 38. Blood pressure is 100. Conjunctival hemorrhages are present. That means bleeding in the eyes are present. Hepatosplenomegaly is there. That means spleen and the liver are quite big. Then there is insufficient urine or oliguria. What are you looking at for? Over here, we are looking at leptospirosis. 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 This is not like the Trichinella that we discussed earlier on, where it was gotten from pork and stuff like that. This is leptospirosis because of not just the gastrocnemius muscles is painful, but they've told you that there's also what anemia present. I mean, bleeding present. Jaundice also what present. Okay, so this will definitely leave it or will make the leptospirosis a little bit what higher. Okay, so that's over here. We are looking at leptospirosis. In some other question, they might add the shape of this leptospira. They might add the shape of it. We might be like C or S. Okay, regardless of the shape being present, this is typical for leptospirosis because it can affect the whole body. It can affect the whole body. It can affect the whole body. Even the brain. It can even go to the brain. So please take note of that. So over here, we're talking about leptospirosis. So the answer should be A, leptospirosis. Leptospirosis. All right. A woman has been working as a polisher for a year and a half. Her workstation is equipped with grinding machine. Guys, we've talked about this like a dozen times. Grinding machine. These are vibration objects or vibration machines. She complains of white discoloration of her fingers and toes that appear when she is nervous. Objectively, there are no changes in the coloration of the distal segment of her limbs. Grip strength measured with a dynamometer is 25 kg. Finance is 0.1, blah, 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 blah. Cold stimulus is extremely positive, blah, 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 blah. Look, cold stimulus, very important. It's positive on the upper and the lower limbs. Internal organs are without any pathology. What is your diagnosis? Guys, they've already told you what this person is suffering from, isn't it? From the onset, this person deals with grinding machines. These are vibration machines, isn't it? And we've talked about it like a dozen times. So over here, we are looking at what? A vibration disease. Vibration disease. Vibration disease. And vibration basically affects the hands, the forearms, while using these vibrating tools. They can lead to numbness of the fingers and stuff like that. Isn't it? That's what we're having in this particular person. But if you check the person's internal organs, there will be nothing. Nothing really wrong with the person, apart from the fact that the person having what? Vibration disease. So your answer should be E. Vibration disease. Vibration disease.